growing weary of running from room to room, practicing one-tooth insurance-driven dentistry? Then stay tuned for the latest episode of The Lionhearted, where Dr. Stephen Rasner will hand you the blueprint for what many call the gold standard of general practice dentistry.
Hi everyone, it's Dr. Steve Rasner, and you are tuned in to The Lionhearted. I want to wish everybody the happy holidays that are about to bestow us all, with Thanksgiving around the corner and of course Christmas and New Year's. Those of you that are tuned in for the first time, these podcasts are weekly and they're my take on a myriad of ideas to make your office more efficient, productive, and a joyful place to be. I've been doing this for 40 years and I've had a pretty good run, and I hope to help you establish the same thing. I know that a lot of you, when you do tune in, you're listening only to the audio on your way to work or to the gym or wherever it is, so we don't have a lot of time, so let me get right to the point. If you want to email me, I appreciate those of you that continue to do so. You can go to my email at drrasner, R-A-S-N-E-R, at AOL. Or you can go to my rasnerinstitute.com if you want to see where I'm speaking in 2020, or if you want to take any of the courses in my office. Tonight, I want to talk to you about something I've never spoken about. And I really gave this some thought about what topic I want to do a broach tonight. And it's the maximally productive office versus the office that sometimes you have a good day, sometimes you don't. Because I think I know exactly why. So what I'm about to say to you does not require any giant investment, but it does require discipline. Your commitment to want things to change. And I'm positive what I'm about to tell you is dead on. Because I've been thinking about it. Like, why is it I come up so consistently with numbers that, according to industry standards, blow them out of the sky? How is it I do that? I don't work on 25 patients a day. That's not my model. So it's not that. So what could it possibly be? And I've narrowed it down to 4 to 5 factors. I want you to really listen to this. If you feel like your office is not performing, if you feel like you're sitting around too much, or you've wasted yet another day, and you don't have that kind of time. So the one thing I'm not going to get into tonight that I'm going to ask you to go back to that does contribute to a lot of my productivity is the case presentation part of my operation. And remember, if you go back to those podcasts, my case presentation begins on the telephone the first time they call, because we're screening out patients that we believe, from doing this for 40 years the way we do it, have a very low chance of being interested in a comprehensive approach that I take to new patients. So if you're tuning in for the first time, some of this might not make total sense unless you go back, and they are well delineated. I got, I think, at least 5 different podcasts that talk about everything from the first phone call to the moment they walk into your office, to what happens next, to when you walk in to the operatory and meet the patient and their significant other the first time. I mean, I wrote it and I broadcasted it, but I think it's so dead on and so spot on. If you follow that, there's no way it's not going to work. So I'm taking that off the table for this podcast. I want to talk about other stuff. And by the way, one of the things I want to talk about, those of you that are in a position to consider this, that maybe you've got a few years under your belt. I don't know what the number would be. But I discovered it accidentally, and I'm talking about the 4-day work week. And that's not the crux of my whole podcast tonight, but it is related in the following way. So, you know from these podcasts that I advocate you making an all in investment of continuing education your whole career. I mean, that is absolutely a cornerstone of how I can even be in this position to speak to you. If I didn't invest the time and the money on learning the things I know as a clinician and even as the owner of the business, then I would never have become anybody that anybody knew about. Not that that was my agenda. So here's the deal. Whenever I took the courses, which I often looked for courses that started on a Friday, if they fit the interest level that I was after, I was working a 4-day week that week instead of a 5-day week. This is how it happened. I mean, I've been on 4-day weeks for 25 years, or at least 20 years. And in the beginning, by the way, do whatever you got to do. You don't have to apologize to anyone in your first 2 to 3 years. You got to let your community know that you exist. And if that means you have to open up a couple nights, a Friday, and every other Saturday, which is what I did, then that's what you have to do. Because the public has to know, especially in today's arena of competition, you have to do what you have to do. That being said, I will tell you, you'll be more productive, more efficient in a 4-day week. Do you know why? Because you have to be. You shrink the 5 to 4. I didn't realize it at the time. But what's happening is you have less hours, less days, so you start thinking things out a lot more efficiently. Maybe it's like being on an island, stranded, and in the beginning you have a week's worth of food. But as you get to the 6th and 7th day, you're thinking more about how you're planning to disperse that food that you have left. It's the same thing. When you have less hours to waste. Hell, there was one year, the year before I became a speaker, when I knew I had speaking engagements and I was scared out of my brains that I didn't have good enough material. And I started to write books too. That year, for at least 9 months of that year, I worked 3 days. And I will tell you, I didn't miss a beat. So that's what made me realize it's not how many days you work, it's what you do those days. So let me get to specifics. It starts, your efficient, maximally efficient day starts with your scheduling. Now hear me out. This is important. You have to have somebody at the helm that's scheduling your hygiene and your schedule that understands urgency. What am I talking about? Well, let's take your schedule for a minute. You need to have somebody that really cares about you being maximally productive. So they are looking ahead for starters. They're not picking up Wednesday schedule on Tuesday. They do a week ahead, look ahead, especially in the beginning of your career when you don't know, you don't have an established history on patients. You don't, do you? So you don't really know who's rock solid yet. Like I would know, because I've been in this 40 years. And so the person that looks, I called it the look ahead. And you know, at this part of my career, I have an associate. And part of this is resonating tonight because I've been getting ticked off because I haven't paid attention to my associate's schedule. And so I'm seeing that she's there on Tuesdays, there seems to be 1 or 2, sometimes 3 broken appointments. How do I know this? I see her not in her operatory, but in, the break room. And so, remember, I said this on many podcasts. Your team only knows what's important to you if you constantly remind them what's important to you. And I have a great front desk that likes to chitter-chatter a little too much sometimes about nothing. And if you guys are watching, which I know you're not, I love you, but it's just the truth. And I'm fine with that. I'm fine with talking about what you're doing this coming weekend. I'm fine with you sipping coffee in the morning and doing as long as you get my job done. And part of that job is a rock solid schedule. And you feel the urgency of that. It's not okay that you start calling the patients. Some of the patients, I guess you can call the day before. But the big ones, maybe one with a big appointment, maybe one with a lot of money due. And that's another reason why I don't get a lot of broken appointments, because I get paid up front. That's one of the reasons to get paid up front. So part of me being maximally efficient is I don't have a lot of downtime on my schedule. And the same with hygiene. I think most of your hygiene breaks, unless you're brand new, if you've been out for like 2 years, it's due to lack of systems, and it's due to a lack of urgency of the person you have in charge. And I know if somebody's watching this right now that has that job, what am I talking about? I've said on another podcast, I'm talking about not leaving a message with a tape machine. And well, you might be saying, well, how do I not do that? You keep calling at the end of the day, and you can block your calls, and you know that, so that your number doesn't show up. I mean, you need to know the score the next day. You can't leave it on a tape machine. You can't be okay with leaving it with a toddler. And and I know I said this about a month ago. That's actually happened to me. I'm going to tell you something. Michelle, if you ever get to see these podcasts, I don't know, but she's my original scheduler, and she still works for me 39 years later. She has a sense of urgency. She understands that an opening in your schedule, and I'm talking like losing an hour, is something you won't get back. Yeah, you just don't get it back. And you guys and I have this same thing. We have 2 hands and 8 hours or whatever hours you designate every day to work it. And if you lose an hour, well, why go to work then if that doesn't matter to you? And remember, I'm not talking about seeing 25 patients. I'm not even talking about seeing 12 patients a day. That would be way too many for me. But I don't want downtime in my schedule. I want downtime when I'm not working. Okay. So lack of the proper person understanding. Now, it may not be that you have the wrong person. It may be simply the person doesn't understand what that job role entails. I'm telling you, I'll say it one more time. We did not permit leaving messages on tape machines or with, I didn't have a cutoff age, but a child, or 11-year-old, or 12-year-old wasn't going to cut it. Did we ever get in trouble by leaving too many messages? Yeah, not often enough not to do it. We would have special notes after that being our policy for years. Only call once. I remember saying this. I'd rather suffer the consequences of that than have broken open appointments. Next, do you have or not a quality 7 to 10 minute morning meeting? If you don't, you're not maximally productive. And it's beyond the scope of this podcast, but there is a podcast dedicated to the morning meeting as well as the monthly meeting. Now, this morning meeting is only about one thing. Will this day work that you're in? So you have to have the schedule out. You got to look at the schedule. My team gets there 30 minutes before I do. And their job is to look at the schedule, break it down. What am I doing? I delegate. And I'd gladly pay my team to do what I'm doing. The hygienists, by the way, just as an aside, are looking at when was the last FMX done on the patients in their schedule. We're not looking to do an FMX every 2 years on a patient that has no restorations. Nothing I ever tell you is about that. It's my philosophy is not about changing out amalgam fillings to white ones to create revenue. That's the last thing I would tell you to do. My philosophy is about you providing a comprehensive exam, so you look at 5 areas that I've delineated in prior podcasts. But I am all about my hygienist taking the time to review the charts so that we know somebody with a history of multiple endos, crowns, ongoing dentistry, is current with the radiographs, researching the chart to have a personal relationship. We don't all remember everybody every time, so it's part of our agenda to put in the notes that they were taking a vacation or had a grandchild coming up. There's a section for that. Or what about work we discussed last time? This is all going on in the hygiene department. My assistants are breaking down my schedule. And yes, if it looks like it's impossible for us to make that schedule work on time, and you know how I feel, the need for you to be on time, then we will call somebody at first thing in the morning and notify them and see if that's going to be okay with them. Now, if you find yourself doing that every single day, then you need to look at your scheduling protocols and why that's happening. Okay? And we're also looking in those times of the year where maybe the day's not so productive, right? Let's just pick, it's happened to me, where I have a day that just doesn't look like it's happening for whatever reason. It doesn't happen too much. So, and certainly earlier in my career it happened. So that's especially where you need to network with your hygienist and have them go through their schedules. Was there anybody in their schedule that we had talked about prior work? And look, if they're not into doing it that day, then they're not into it. But why not be prepared just in the event that in fact it might happen and that you didn't know about it? That wouldn't be good. Wouldn't it be terrible to have downtime for 45 minutes and realize you had somebody in hygiene that rescheduled in 2 weeks and could have done the crown that day, or operative dentistry, or anything? I'll say it again. When I'm at my office, I'm there to work. Not to go 100 miles an hour, but certainly not to go in my room and look at the stock market or play on my computer. I can do that on my off days. Okay. And by the way, the morning meetings are not a time for you to deviate and talk about some toxic things that are going on in the office. That is not part of the morning meeting, and your team needs to know that. Let me tell you another factor that might shed a light to you that you've heard me talk about, and that is that sedation dentistry makes you very efficient. It does. And one other thing. Most of you are in states now, that this goes with the sedation, that allow your hygienist to anesthetize the patient. So you don't have to agree with everything I say. Of course you don't. But what I do in my office, and I think it's worth every penny, is I pay my hygienist, and you can write to me and ask me how I pay them, but it comes out to I'm told it comes out to about $5 an hour. So that would be, in my office, we usually have 2 hygienists, so 5 times, be $80 a day, 40 for each of them, to anesthetize my patient. It's probably not quite 80 because they're not doing it all day long. And you might say, are you out of your mind? I am not out of my mind at all. I find it worth every dime and maximally efficient to walk into a room. Imagine this. They're sedated certainly 50% of the time in my office, and they're anesthetized when I walk in. I find that pretty darn efficient. So sedation dentistry, you don't have to spend a lot of time talking about nonsense or dealing with the patient to try to get it together, because my sedation protocol puts them 90+% of the time in a behavior pattern that is conducive to you being maximally productive. A lot of times, and I usually at a meeting and I don't have the time to really cognitize how do I produce these numbers. This is why. It's not one thing. And I'll leave you with this. If you're not efficient, it may be a lack of systems literally of how you do things in your office. Now, I know what I'm about to say is not profound, but I also know not every office embraces it. So every one of my rooms, for example, and I have 7 rooms, they're cloned. They literally look the same in terms of the cabinetry, the chairs, etc. But even if they didn't look the same, everything in the drawers are exactly the same in every room. So a brand new dental assistant would know in a matter of a week where everything is. And of course I use a tub and a tray system. So, and everything is in the trays, excuse me. So, it's a composite tray, it's an endo tray, it's extraction. And they're the same wherever the cotton rolls to the Vitrabond to the only things that float from room to room would be things of greater expense that I'm just not going to put in every room, like an electrosurge unit. Or, we have pulse oximeters in every one of my rooms. But if I didn't, of course, those things would float from room to room. So the design of the office so that everybody knows where everything is. It's not, hey, where's the composite at? Another thing along those lines is that I believe, unless you don't have filled schedules, I'll tell you what I would do before I would go out and hire an associate. I would hire an extra assistant. So hear this out. I have to tell you that I always do 6-handed dentistry. I don't know if anybody's even talking about that, but I've been doing it for a long time. And I find it not only efficient, but I find the products I deliver are higher quality. So I have a main assistant evacuating the mouth. That is what she's dedicated to, keeping the patient comfortable, adjusting lights. I have a second assistant getting and handing, if we're doing a core buildup, the Bill Strupp technique way. There's 7-8 steps involved in that. So, if you're evacuating the mouth as an assistant and you're getting supplies, the mouth can fill up and get contaminated unless you're using a rubber dam. And I don't use a rubber dam on every single procedure. For sure I don't. So I find it maximally efficient. I look down my hallway, even when I'm working by myself. And you can make an argument that I'm overstaffed. I have a sterilization assistant because I need my office and your office to look immaculate all the time. I want never to be waiting for even a minute for a product that maybe ran low. Lidocaine or articaine or something like that. I want them stocked all the time in the rooms. So I have 6 hands, my 2 and the 2 of my 2 dental assistants at all times when I'm working. And I think that makes you very efficient. I do. And it certainly makes the quality of your work better. The other thing is and I'll leave it with this, is delegation. Everybody has defined job roles. That includes the person in charge of ordering supplies. And we use the tag system. And any of these that if you don't understand, write to me and I'll gladly pass on the information. But I can't remember the last time my office ran out of something. The person in charge of labs, checking in labs. I can't remember, although it's happened in my career, the last time somebody came in for a lab case and the lab case wasn't here. And in my office today, that would include guided surgeries and the guides. There's a lot of moving parts going on. I have people in charge of changing lights when they go out. If you have 7 operatories, lights can die over the course of a year. I have a person in charge of keeping the kitchen clean. Now that person rotates weekly. And by the way, I don't know if I'm sounding like a dictator or Napoleon. I'm not like that. What I'm saying to you is I pay my people at the top of the chain of what that person makes in another office. And all I ask is that don't make me ask you more than once to do a certain job. Because I find that incredibly demoralizing to me, and it strifes my creativity when the back of my head is always worried about asking somebody to just send that handpiece out. By the way, somebody's in charge of repairs. So these things, by the way, these systems that I'm talking about take time to develop. So don't be hard on yourself. You could accomplish every one of the things I just said in the next 6 months if you wrote a list, or if you write to me, I'll help you get it started, and you started implementing it. And that's the last thing I'll leave you with. Yes, we have morning meetings. Yes, we have monthly meetings. But we also have on-the-spot meetings for 5 minutes, maybe once or twice a month, with my crew, my clinical crew, in the office, in the break room, where I don't want it to wait. Something happened that I don't want to wait. Something with a lack of quality, something with a lack of organization, something that's counter to a relationship-based practice that I believe your practice should be. Remember, 2 things I'll close with. Your team is only going to know what's important to you if you remind them. They have other things in their life. Children, families, life. And if you're not sure whether you should bring it up, you should bring it up. You should. You've got this one life, this one practice, or this one organization, whether that consists of one practice or multiple practices. And you need to give it your fullest attention and take the time. It's not like I go in every week and every minute of the day and say, I got to do all that. It just happens. No more than I know how many times I've blinked during this podcast. I'm not thinking about it. Once you put it in motion, it works on its own for you. So if you're looking for greater efficiency, maybe I'll write a blog on this if you ask me to. Beth, perhaps I'll do that and put this all together, because remember, this was born from this concept tonight, from people asking me, how do I do the numbers? And maybe you think it's because, and remember I said it starts at the case presentation. If I don't have people saying yes, then I don't have them scheduled. Then it overlaps into getting paid up front a lot, because when I get paid up front, I don't have to worry nearly as much about broken appointments. But that wouldn't include hygiene. 3, then you have a person who understands the word urgency. Maybe that's an overstatement, but not to me. I have 4 days a week to work. I want to kill it on every single day. And that doesn't mean running around like a chicken without my head, but it does mean not having wasted downtime, broken appointments. I hope this helps some of you. I hope you're having a great part of the year and kill it right through the new year. This is Steve Rasner with The Lionhearted, and I'll see you next week.